Tonight we continue to delve into the healthcare debate and the crisis that could result if major changes are made. Some would say crisis is coming if changes aren't made. Right now we take a look at how people who get insurance from their employer could be affected. Consumer investigator Hank Winchester joins us. Hank, we know well that fewer employers these days are offering insurance, but it's still a lot of people. That's where they get their coverage.
Yeah, Devin, we're talking about millions of Americans. In fact, as you know, thousands have made their way to work here in the heart of downtown Detroit. Major corporations luring people with the idea of not only good wages, but also a benefits package. But the question tonight is, could those corporate benefits go away?
There it is.
Here at the Recovery Project in Livonia, it's all about rehabilitation and taking care of your health. For the founder, Charlie Parkhill, it's personal.
We provide Blue Cross Blue Shield PPO. From day one, we've asked what their best package is available, and we've had it ever since.
Healthcare for patients a priority here, but also for those who work here. And it really doesn't matter what happens with Obama or Trump care. The focus remains on providing quality health care for employees.
It looks like in the new offering from the Senate that they're going to include the tax on the so-called Cadillac plans. Looks like it's going to stay in, at least that's just from the brief things I saw. So we'll still be hit a little bit by that. Our premiums will stay up because of that.
But for some employers, especially smaller companies, that may soon all change. Under the new health care plans, employers could opt out to dramatically change coverage plans or possibly altogether stop offering health care to employees.
If you have a traditional employer-based plan, there's very little that's going to change with that in the immediate future. Right? On the margins, right, if you're working for a smaller employer, there could be a tendency over time for them to drop coverage and no longer provide coverage. And if states start to make substantial changes in the insurance regulations on what the insurance has to be providing, that could have some longer-term consequences.
Yeah. Dr. Peter Hammer, professor of law at Wayne State, says employers will be taking a close look at the changes under Trump care. And they will also look at whether it will affect their employee plans.
The existing laws require certain aspects of the employer plan, or all insurance plans. If you look at the House bill and the sort of the last-minute compromises that let states start to get waivers of those rules, states that have waivers can start to change substantially what is the nature of an insurance plan that can be sold.
If just one major corporation stops offering employee plans, well, you could see a domino effect. But then those that are offering top-notch health care may have an advantage trying to attract new talent and employees.
Our model is taking care of our clients because of what we do. So we think if we take care of our staff, they're going to take care of the clients, and they know that those kind of things have never been a financial decision for us.
And right now, those watching this debate very closely say in the future, if employers start dropping health care, it's likely going to be those with a small workforce, those under 75 or 70 employees. Right now, though, that vote on this health care proposal has been pushed back till after the 4th of July holiday. Take a look. There are 9 GOP senators right now currently opposing the plan as it is written. But there could be a lot of negotiating, a lot of changes that will take place. And again, as of right now, a vote not expected at the earliest until right after the 4th. We're live here, downtown Detroit. Hank Winchester, back to you.
Yeah, originally was aimed to take place tomorrow. Not going to happen. We'll continue to follow it. All right, Hank.